Postoperative pain is usually instigated by inflammation as a result of tissue trauma, such as dissection, surgical incision, or direct nerve damage. Pain is detected via the afferent pathway, which is the target of pharmacological interventions for pain management. Conventional postoperative pain management used only opioids to relieve pain. However, the contemporary approach uses several pharmacological agents acting at different pain pathway sites. This is called multimodal analgesia. With ever-increasing access to technology and research material, registered nurses ought to endeavour to engage in evidence-based practice in order to provide safe, efficient, and effective care to consumers. There is sufficient evidence available from high-quality systematic reviews of postoperative pain management. However, the issue of inadequately controlled pain prevails. Repetitive pain assessments and measurements of pain leads to superior acute perioperative pain management. The registered nurse must constantly review the pain of the post-operative patient. However, this assessment is repeatedly disregarded and leads to increased pain and decreased patient satisfaction. However, Humney 2016 states nurses are instructed to assess pain every 4 hours, employing the use of visual inspection combined with the numerical rating pain scale often portrays a transparent indication of pain. The registered nurse ought to use the PQRST method as a means to gain a further understanding of the pain being experienced. The patient should be encouraged to self-report any changes in pain, as pain is subjective. However, healthcare professionals require excellent communication skills in order to facilitate open communication, and trust is essential. The registered nurse ought to establish pain goals as a means to identify if an intervention has been successful. However, these strategies in pain reduction are underutilized. In a situation where postoperative pain is not well controlled, the consumer may experience adverse events that may include insomnia, reduced mobility, and atelectasis. The reprieve of suffering has many positive benefits to the patient. It encourages early mobilization, decreased hospital stay, reduction in hospital costs, and improved patient satisfaction. Appropriate postoperative pain management is a significant nursing issue, and registered nurses, along with their medical colleagues, need to engage with the latest scientific evidence to provide the most effective care. When considering post-operative pain management, it is important to assess the likelihood of how much pain the patient will experience. For example, a patient has a minor day surgery procedure such as the excision of a small mass. It is generally recognized that the patient will experience a low level of pain for a short period of time. Conversely, if a patient were to have an invasive procedure such as a total knee replacement, the patient may experience moderate to severe pain that may last many weeks. However, pain is subjective and an individual approach must be taken as each case significantly varies. Shug 2016 advocates for procedure-specific pain control. This method detracts from the consumer's individual experience of pain and may allow pain to go uncontrolled. Methods of establishing effective pain management include the following. Local anesthesia is injected in close proximity to the surgical site to relieve pain. It can be used across all categories of surgery, from dental to cardiopulmonary surgery. It is usually administered via infiltration, injection, or topically. Local anesthesia is conventionally used in conjunction with general anesthesia and/or sedation, but may be administered on its own. A randomized trial found that the use of local anesthesia greatly reduces analgesic consumption. Systemic analgesia acts on the central nervous system to reduce pain. It usually consists of multimodal combination of non-steroidal anti-inflammatory drugs, paracetamol, opioids, and neuropathic pain agents. Randomized controlled trials suggest the use of NSAIDs greatly reduces the consumption of opioids, pain intensity, and postoperative nausea and vomiting. The use of lidocaine as an alternative systemic analgesia to opioids contributes to the prompt return of bowel function. The use of neuropathic pain agents such as pregabalin and gabapentin also reduces the consumption of postoperative opioids. Employing the use of patient-controlled analgesia in postoperative pain management allows the consumer to self-administer small doses of analgesia on a when-required PRN basis. The route of administration is generally intravenous, and the pharmacological agent is usually an opioid. The PCA system provides the patient with enhanced analgesia coverage than the traditional opioid regimen that is delivered via intramuscular injection or orally. PCA also increases patient experience and satisfaction. Many frontline healthcare professionals do not commonly advocate psychological interventions in postoperative pain management, as patient benefits in academic research have been variable. Registered nurses may not feel confident in their ability to provide psychological care in the postoperative setting. This may be dependent on their level of experience or due to lack of time. According to Queckenbaum and Gerstdottir, 2006, 3 out of 7 studies conducted produced results of significant pain reduction. The most evident was the use of systemic muscle relaxation technique in postoperative pain management. There are many complexities facing the nursing profession when it comes to providing evidence-based practice daily on the ward. According to Ross, 2010, in a survey, only 20.8% of registered nurses engaged in evidence-based practice in the management of postoperative pain. A further 76.4% of registered nurses cited lack of managerial support and resources as reasons for not engaging in evidence-based practice. This research clearly demonstrates the gap between evidence and clinical practice for the registered nurse. Evidence-based practice needs to become an integral component for all healthcare professionals. There are many practice gaps in post-operative pain management. There are many solutions to bridge the research gap in everyday nursing. These include allocating time for each nurse to engage in scholarly research, educating nurses on the importance of keeping their clinical knowledge and skills up to date, and the financial benefits to the ward, hospital, and the taxpayer. Engaging in evidence-based practice enhances the profession of nursing. It demonstrates that nurses are imperative to positive healthcare outcomes and valuable sources of information. In order to achieve these objectives, there ought to be a change in nursing attitudes, policy implementation, funding, and recognition of how important the nursing profession is. The quality required to be demonstrated from hospital management and administration to implement evidence-based practice is effective leadership. There are various barriers to effectively manage postoperative pain. The most apparent are patients' fear of addiction to opioids and anxiety about adverse effects. These barriers, combined with the healthcare professionals' prioritizations, time management, and workload, often create an environment where pain is poorly controlled.